Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're talking about children's orthodontics now. There's a whole bunch of things that show up in children. Some of them show up in adults too later on down there, but in this particular case, we close the space by using reverse headgear. A young lady who was missing a bunch of her permanent teeth in here, and we close that space up by using reverse headgear. And that's one way to do it. And you can do that with adults too, but having them wear reverse headgears, it's a little harder to do that. So let's get going on the case, and we'll show this. She was just a neat child, and we enjoyed having her. And she was missing, if I remember correctly, 9.5 teeth were missing in her mouth. And this is, you'll see on the right side over here of her, this is a little kind of a malformed lateral, but we go ahead and use it. Over here she was missing the lateral tooth completely, and then she's missing some of the adult cases too. So let's go down. These are deciduous teeth here. The permanent teeth are just not there. And same way over on the other side. If I remember correctly, we called it, she was missing 9.5 teeth in here. We'll show that over the x-ray in a little bit. Now this is 8 of 71. We were doing this way back there. And so this is not something we hatched up 15 or 20 years ago. This was 8 of 71, unless I'm really messed up on here. That's 71 again. And there she was missing these teeth. And so I told her, we'll have to wear this headgear. If I pull these teeth back, you're going to be sunk in the face. So she agreed to wear this headgear, and we're going to move these teeth forward from the back to the front with reverse headgear. And then we open this space up and put a crown in at a normal size. And on the other side, we opened the space, and we had to put a bridge work in that. We had nothing to put in the gap. So here we'll show this on x-rays here in just a few minutes. We took those deciduous teeth out because you would lose them down the line anyway. Now this is a neat type of reverse headgear, and it has a strap across the head like this, and they can pull their hair forward, throw it back and not see anything, and they won't even see this wire coming down around their neck. And then we put a little chin cup down here, and it pulls the teeth in a forward direction by pulling down on the facial structure here. And watch that case work like that. Now you make these, and you make them where they're coming just through the lips, right where they normally close. Don't have a thing down like this or up like this, but where they close together, you put your hooks back to the teeth to pull that through there. And she made faces like that. We kidded her a lot. And this was back in when we had bands on everything. And so I'm going to go through this pretty quick. And we closed that space and brought those teeth forward with that reverse headgear. And she agreed to wear that, and we didn't have to dish her face in to close that or put bridges in her mouth to fill it. We used her permanent teeth to do that. Now here you see she's got no teeth here. She's missing the wisdom teeth, no teeth, This is the wisdom teeth. But we had a tooth here, and maybe it was a wisdom tooth, and there was no 12-year molar. This is the part we call that a half of a tooth, and over here we got a cuspid. We're going to have to open that up to put a space, close that space right there. So here, this reverse headgear worked great.